Cases of influenza-like illness and severe acute respiratory illness are in fact increasing in the country. What are the reasons behind it? What all influenza seasonal issues are being faced by people, and how to protect your loved ones from these influenza viruses is something that we are going to discuss today. And we are joined by none other than the member of NTAGI and also the co-chair of INSAGOG, Dr. N.K. Arora. So thank you for joining us. My first question to you is that we are seeing around 900 cases of H3N2 and there are about 500 cases of H3N2. When we see the cases are increasing, but is it something new or is it very normal that we are seeing at the moment?
Thank you very much for inviting me. And I must congratulate the media for creating awareness. And I think we should be thankful to COVID also. These cases, influenza has been here in the country for years. Yes. And even H3N2, which there is a lot of talk about, is not new. And H1N1 is pandemic influenza, which occurs all over the world. And it is good to have good awareness about it. And I must also say that now India has a very good surveillance program for influenza. ICMR has an extensive network across the country where samples are picked up, and therefore we know what is happening, and we also know that seasonal variations or changes occur. As you very rightly said, that during last few weeks there has been an upsurge of cases of influenza-like illness, which is called ILI or influenza-like illness. And important point is, at this time, I would like to assure that most of the times these cases are COVID, not COVID, but they are influenza. Because presentation of COVID infection as well as influenza infection is very similar. You have fever, you have upper respiratory tract symptoms, nasal discharge, cough, there may be body aches. So they are very similar. But whatever we are seeing, most of these cases currently are influenza related. They can be either H3 or H3N2 or it can be H1N1, either of these. But the important point is that on the basis of symptoms, we cannot say what kind of influenza infection is this.
All right, okay. But can you differentiate between a COVID symptom and an H3N2 symptom, or, because there are cases of COVID also now coming up. So how can one differentiate between the symptoms?
So on the basis of clinical symptoms, it cannot be differentiated. They are very similar. In fact, when we are doing surveillance, either for COVID or for influenza, the same symptom complex is followed, that anybody having similar symptoms, fever, respiratory symptoms, and if there is severity, breathing difficulty occurs. But without a lab test, you cannot differentiate between the two.
All right. So you suggest that if you feel that symptoms, then one should go ahead and get checked?
Yes. Particularly, it has to be understood very clearly that if an individual has comorbidities, and what does comorbidity means? Comorbidity means if somebody has diabetes, high blood pressure, is on cancer drugs, the patient is being treated for chronic kidney disease or liver disease, or has lung disorders, chronic lung disorders. A lot of them can have, if somebody has severe asthma. In these cases, if an infection either with influenza virus or COVID virus occurs, the risk of severity increases by 6 to 10 times. And it is here that the family as well as the individual has to be careful, and they should go in for a testing to find out the type of infection.
Okay. Also, when we talk about the increase in cases, do you think that perhaps this time there is an increase? Is this unprecedented, or probably it's like a fear?
So last year during the same time, COVID was occurring in 10, 20, 30,000 per day. Within that group, 400, 500 cases of influenza were invisible.
Yeah.
Today, COVID cases are between 150 to 500. So influenza has become visible.
Okay.
So it is very difficult, but looks like that because COVID is very less, we are able to get more of these cases. We feel that there is an increase, but no. Absolute increase, very difficult to say that.
All right. And also I want to ask you is that though the symptoms of COVID and such influenza is very similar, but do you think that such influenza viruses are life-threatening like COVID-19 was once?
It is certainly not as life-threatening as COVID was happening. And there are 2 or 3 reasons for that. One is biological reason, that our population and our bodies were being exposed or were exposed to COVID virus for the first time. And as a result, when you have first exposures, the risk of severity is higher. On the other hand, various forms and variants of influenza are circulating. We have heard about Spanish flu that was more than 100 years ago, and after that, year by year, virus does circulate. So all of us are exposed to virus, and therefore risk of severity decreases. Although there are changes in the different changes in the antigen, but risk of severity is much less once you are exposed previously.
So it's not that life-threatening.
That's correct.
All right. Apart from that, who are really vulnerable when we talk about the severity? Who are more vulnerable? You talk about the comorbidity one, but are children also more vulnerable as far as the influenza is concerned?
So those children, particularly below 1 year, are vulnerable, and particularly if they also have some comorbidities like congenital heart disease, any other congenital abnormalities, if they are having any kidney or other disorders, because children can have those disorders. On the other hand, at the other extreme, those who are above 60 years and have comorbidities, the risk increases. In between, whatever age group it is, and some of the comorbidities I mentioned, they are important. So extremes of age groups and anybody having comorbidities, these are broad 3 categories where the individual as well as families have to be more careful. If the symptoms are getting severe, increasing, there is difficulty in breathing, then one should seek medical care promptly before it becomes bad.
Also, we are seeing that there is an increase in COVID cases also. After almost over 100 days, we are seeing an uptick as far as the cases are concerned. Around 500 cases were reported. Is that concerning at the moment?
See, increase from 150 to 500 looks 3 times increase. But if you look at the denominator of 1.4 billion, the important point is there are no localized outbreaks. And the initial what genomic surveillance we are doing, we don't find any new subvariant, anything coming up. But we have to keep a watch that there is an increase. This may have something to do overall that as influenza virus or the other viruses are more likely to kind of circulate and infect. Similarly, COVID, there may be some increase. But I would say there is nothing to panic, nothing to be very worried. But system is keeping a very close eye on these small increases.
So what are the measures one can take to avoid influenza at home? Are there home remedies the best, or going to the doctor?
So let's talk about precaution and prevention. The prevention is exactly like COVID. So washing your hands frequently and greeting each other with namaskar rather than shaking hands is very important and very useful. And third thing is that those who are infected should wear a mask. So if I have symptoms, if I wear the mask, I will prevent the infection to spread to my family members to begin with, and then the others. And within the family, we should be very careful that we do not use common towels and other kind of clothings or those kind of things. So the spread within the family occurs very rapidly. And particularly we have to be careful if there are small children or elderly in the family.
2 last questions. One is that we are seeing a rise in the heart attacks and strokes. Do you think that this is an aftermath of probably, because of COVID-19, it is affecting all organs? What is really the reason that we are seeing the...
So this is, I think, there are some studies going on.
Yes, I see.
One does not put it that if issue has been raised, so we should have evidence either positive or negative. We should find the exact truth. But overall, from global evidence and whatever preliminary evidence from within India is also that most of these activities are incidentally, they are being noticed at the moment. And linkage with either COVID infection or COVID vaccination is very difficult to establish.
Okay.
There are good studies done in other countries where they have shown that there is no evidence. So when we see suddenly a young person collapsing and dying, or a 40-year person or 60-year and all those, so I think immediately incriminating either COVID or COVID vaccine is not a good idea. We should get the investigations done. There may be other reasons. So many of the people who have recently been reported, younger people, and in their postmortem examination, they already had a pre-existing very severe heart disease or some other diseases. So it's a premature interpretation. Let the scientific studies speak for themselves.
So do you agree that it's unusual? So many people...
No, it is not unusual. I think it is, most likely it is being noticed more closely because we are more vigilant about it. Just like today we are talking about influenza, while influenza has been circulating all these years. I think we should wait for scientific studies and the evidence.
One last question. Is COVID almost done in India? Is it endemic? You know, I'm talking about beyond endemic point now.
No, COVID is circulating in different parts of the world. We are also having COVID and various subvariants are circulating. And I think complacency is not a good idea. Systems are in place. We have a very good surveillance, patient surveillance, human surveillance going on. There is a sewage surveillance also going on. And the data is being looked at in a weekly manner. So that sensitivity has to be maintained. Almost all of us have resumed our normal activities, our daily routines, businesses have started again. So we should be vigilant on this, because in certain parts of the world, even today, let us talk about North America, even 200 to 500 deaths per day are occurring in that population, and which are attributed to COVID. So one cannot be complacent, and we should wait.
Okay, before I let you go, one question, because you mentioned that it's not, as far as influenza is concerned, it's not as COVID, that dangerous. But there are deaths that we are reporting, we have seen that the deaths are reported. Are you saying that it's not directly linked to the influenza, or is it because of the comorbidities?
That's a very important point, that all those individuals, whichever age group it is, if somebody has a comorbidity and on top of that a viral infection which primarily affects the respiratory tract infection, the risk of severe disease increases several fold. And that is what. So, and the other point I made was that because we are being exposed to influenza year after year for almost over 100 years. So as a result, overall severity remains low. But in an individual, because of the underlying condition, it can be as severe as COVID infection.
All right, thank you. So that was Dr. N.K. Arora speaking exclusively to CNN News 18 with video journalist Rakesh. This is Shen Elizabeth in Delhi for CNN News 18.